So there's a few other liver treatments. So first of all, because of anaphylactic shock, first of all, immune point may be the thing, that might help, but because of anaphylactic shock, so the liver is very susceptible to toxins. So toxicity treatment for us is kidney 9 and large intestine 15. We didn't see the treatment, but remember I checked it on someone yesterday. Okay. Large intestine 15 is our main toxicity. That treatment, kidney 9 and large intestine 15, is also our skin treatment. Skin problems, we tend to do kidney and large intestine 15. So some liver issues, that would be the main treatment that we would look at. Kidney 9. Kidney 9 generally also can be a liver treatment if you're not sure. Sometimes they say sharp here or dull here, or it's just not clear to them what it is. Kidney 9 might be the treatment that we'll use. Then you also have for liver, you have take 220 and go towards between the bladder and the gallbladder channels. You may find a depression on the right side. That's another point that we use for liver, undefined liver. Okay? And then you have in the inguinal, gallbladder 27, 28, needle towards the leg will relieve, because it's like, think about it this way, the inguinal will treat the rib cage. They're the definitions of the abdomen sort of thing. So this will treat this. This is something, by the way, this gallbladder 27 needle towards the leg is something we use also a lot for hot flashes. Okay. Hot flashes is adrenal treatment. That's just the nature of lectures. They move all over the place. Adrenal treatment, which makes sense to you from TCM perspective, right? Kidney deficiency. Plus spleen 9 upwards, plus gallbladder 34 towards spleen 9, plus gallbladder 27 or 28, something in the inguinal towards the leg. The inguinal is very good for the rib cage. Okay. And
can you just repeat that last bit?
Of the hot flashes treatment? Okay. Adrenal. Usually with hot flashes it's going to be kidney 7 rather than kidney 6, but I'm not committed to that. Okay. Plus spleen 9 upwards, plus gallbladder 34 towards spleen 9, plus gallbladder 27 towards the leg.
Okay.
Okay?
And that's both sides?
That's both sides, yes. I've never seen a woman who said I have hot flashes on the left side, not on the right. So, but if you do, you might try and treat her only on the left. Some things take precedence over other things. Okay. So yes, you can. The thing is, okay. So first, what are these things? Diabetic patients. Okay. Diabetic patient, if they're clearly diabetic, doesn't matter type 1, type 2, type whatever, 5, I don't care. No matter what they come for, back pain, shoulder pain, whatever, your treatment is spleen 3, adrenal, immune. Okay, so we've seen all of these up to now. And we call OD point, which is take your navel, take your rib cage, 45 degrees between the navel and the rib cage, halfway. Okay, so you can say, I'm not going to call it right side stomach 22, because stomach 22 is called Guanmen, okay, gate of gate. OD sphincter is the gate of all the gates, sort of thing, okay? So, spleen 3 plus adrenal plus immune plus OD is the treatment for diabetes. On the back, it's T11 and T12, either Rata or DuPont's. Now, so diabetic, you start there and no, don't just throw the points in. Whatever there's no reflex for diabetes. Whatever reflexes you find, see if spleen 3, adrenal, immune are fixing those reflexes. And then see if, by the way, does it fix your symptom? In all likelihood it will. So when someone has diabetes, when someone has autoimmune, when someone usually with thyroid also, and often with blood pressure, those 4 things, going for that protocol.
The same one?
No. Their own protocols, so we'll go through those 4 protocols in a second. Those 4 conditions, thyroid, diabetes, autoimmune, blood pressure. Try and see, you're better off prioritizing the treatment for that condition above everything else and see if that resolves the abdomen. Now, if it totally doesn't, hey, listen, people can say that they have diabetes and they really don't. That's really possible. I know it sounds weird, but it's the kind of diabetes that does not respond to this treatment. But that generally will be their root treatment. These things take precedence. Okay, so let's go over those. I know that there's more questions. So let's go over those 4 conditions. So we just did diabetes. Autoimmune, we talked yesterday. REN4 plus kidney points plus lung points.
Autoimmune is REN4.
REN4 plus kidney points plus lung points. Why? Because it's systemic inflammation. Use systemic metal water. Metal is lungs and kidney is water. And REN4 is basically fire, younger fire. If they have a slow pulse, you cannot do REN4. And for slow pulse, we do the equivalent on the back, which is UB27, the shoe point of the small intestine, plus the lung is represented by either UB13 or 42, and the kidney will be represented by either UB23 or 52. Okay? So that's your autoimmune treatment. Someone comes and they say, I have lupus, it doesn't matter. I have lupus, don't worry, I'm taking prednisone and I'm very happy, but I have a headache. Can you treat my headache? Besides whatever else you'll do for the headache, start them with this autoimmune treatment, because that's their underneath, that's probably the most important thing they have. There will always be violations of that rule, by the way.
Is that rheumatoid arthritis as well?
Yes, it's autoimmune. That's not the same for osteoarthritis. Your treatment is going to be kidney 7 and 27. Kidney 7 and 27 for osteo. But rheumatoid is, you're still going to have a kidney, it may not be 7. And you will need the REN4 or Wushu. By the way, autoimmune, like that is Crohn's and ulcerative colitis, you cannot use REN4, even if the pulse is not slow, because they may have inflammation in that area. You do not want to stick a needle in REN4. Okay. The next one is thyroid belongs in the kidney category. So do you see that how all these treatments of essential things, if they have this thing, they all seem to revolve around kidneys. Thyroid is in the kidney category. It will show on stomach 9 or large intestine 18 or below or above in the SCM somewhere. And you need to treat kidney. So always check kidney 2 to decide if you need to do kidney 7 or 10. Or officially kidney 3 needle towards the Achilles is best for hypothyroid. I must confess that I do not find that that's true. Okay, I check which kidney point is going to do it. For goiter, enlarged thyroid, generally kidney 9 does the better job. Don't forget that many thyroid issues are actually autoimmune issues. So yes, you're going to have kidney, but don't forget your lung and your REN4. Okay? Or you can substitute Wushu for REN4. And on the back, for hypo, not hyper, for hypothyroid, you do that due to possibly L2, but definitely T11, T12, T7, and T5. Activate the DO channel.
And that is for under.
That is for an under
But
thyroid, not for an overactive thyroid. Do not activate the DO for an overactive thyroid.
And what happens if a person is on medication for the thyroid?
They're still under.
Yeah.
They're still hypo by constitution, just because they're taking medication. By the way, another great point for thyroid, remember I showed you behind can you see there's the tendon, under the tendon? That's a thyroid point, or neck releasing point, or ear point.
Yeah.
Okay, so use that for issues with thyroid.
Needle that one. How do you needle that one?
Slightly up, in and up, in the direction of my finger.
Tendon under behind the ear, and that's for both hyper.
Hypo or hyper, yeah. And kidneys also for both hyper or hyper. Okay? And blood pressure, generally the reason why you would tend to treat blood pressure treatment first is because if the blood pressure, especially with low, if they have low blood pressure, nothing's going to move until that blood pressure gets pushed up a little bit. So all your other treatments are going to nothing's going to, they're going to be frustrating. You press on this, and nothing's fixing. Then when you do under third toe, spleen 6, spleen 9 plus pericardium, which is a treatment for blood pressure, when you do that, suddenly all your other treatments start to work.
And under third toe.
Under third toe is your main point of blood pressure. Now, so autonomic nervous system, again, sympathetic dominance under the third toe. So people who don't respond well, if you jack up the nervous system a little bit, or smooth it out a little bit, depending on how you want to look at it, they're going to be able to start to respond. So those are a bunch of conditions that are sort of primary. They take precedence over everything else. One more possibility for one of those kind of don't ignore, you may need it, otherwise nothing will work, is the immune type. The person who, I had my tonsils removed, my adenoids removed, my blood removed, that kind of person, you may need to start with immune point, because until you do the immune point, nothing else will respond. And then after you put in the immune point, all the other things that you tried before and didn't seem to work will start working. Okay? Okay, let's just finish those symptoms, and the patient is here, right?
Yeah.
Okay. 2 more minutes, is that okay? You good? Okay, thank you. So, always for any orthopedic issue, check gallbladder 26. That's especially true for any kind of back pain, shoulder pain, or knee pain. There are more orthopedic issues besides that, but that covers a fair amount. The reason why is, look, you're twisting around gallbladder 26. That's your major twist area. Okay? And once you have twist, you're much more likely to have problems, structural problems. So to release, so you can check gallbladder 26 left and right. Now, just because the symptoms on the right doesn't mean that gallbladder 26 will be tight on the right. It could be opposite. Whichever side you find the tightness, release it. You release gallbladder 26 with kidney 7. Kidney 7, gallbladder 26 are good friends. And then you can needle gallbladder 26, and you can put more than one needle in gallbladder 26. And remember, my gallbladder 26 is totally to the side. I'm not interested in below the 11th rib. Okay? And of course, check it against the symptom. But it's one of your big tricks. So that's another one, especially if you do a lot of musculoskeletal stuff. That's one of those things I would start. If you learn nothing else besides metal water treatments and Sanjo A to release the SCM, gallbladder 26, especially shoulder problems, especially car accident. In a car accident, they're wearing, hopefully they wore a seatbelt. Okay? They're going to twist. Okay? In this, what side are you driving? Okay, so your seatbelt is this way. Okay? My side is this way, your side must be this way. Okay, so if they're driving and got rear-ended, they're going to go forward like that. They can't go forward like that. Even if they break if they break through the windshield, there still had to be a twist towards the right if they were driving. Just because of the seatbelt. Or maybe they didn't wear a seatbelt, and that's fine. I'm not judging. So always check gallbladder 26.
Release with
kidney 7 first, then needle gallbladder 26.
Which way do you needle that?
Gallbladder 26, you needle slightly down and almost like towards round 6. But don't go forward totally. It's like you're trying to aim. Think of it as needling towards L2 or below. L2, but you're needling towards the back. Yeah, not towards the front. And the last 2 things we have here are kidney 13 and stomach 28, because these are gynecological reflexes. Kidney 13 is a uterus reflex. Although it reflects on the kidney channel, because the uterus is closer in than the ovaries, the uterus belongs in the spleen and or the liver category. So either liver 8, fibroids, by the way, liver 8 is the point for fibroids. Just like liver 5 is the point for inflammations or endometriosis, liver 8 is the point for fibroids. Okay? or spleen. And if you want to get, and the ovaries, which reflect in stomach 28, belong in the kidney category. Very commonly kidney 7. And since we're in gynecology, do not forget, UB66 is our major hormonal point, hormonal adjusting points. Hormonal issues can show, as far as reflexes, there's no clarity, but they can show on UB2, and they can show under the occiput. But any finding in the abdomen, if you are originally a hormonal problem, UB66 might be the solution to the rest of the reflexes. So this is where the system is not, this reflex do this. This is more, what are the ideas, what is the medical history? Okay, are we good? Yes?
Can I ask how you locate liver A?
Yes, and can I show you on
Yeah,
on her,
great.
because she's gonna. So would you like to come in? And once she's on the table, I'll show you with it. But it should be level. It's at the edge of the crease. It's not above. So, yeah. So tell us what you're here for.
I haven't had any major traumatic incidences, but I do. I'm very much aware that when I'm standing, I tend to do this,
Okay.
and literally like this. I mean, obviously,
You're trying not to do it.
I'm more aware of it now, and I'm
Yeah.
trying to do something. But this is my usual sort of posture, and it creates all sorts of problems. And I'm very tense. I'm really always very tense to the point of
Tense emotion or tense in the body?
oh,
Oh, okay. And what kind of problems does this create?
Well, because I think it really does. Well, it creates pain in the lower area here.
Okay.
Not massive though. It's just that I'm aware of it, and it creates more tension. I find if I can remember to actually stand the way I'm supposed to stand, then I don't have sort of tension in this area around here. I also have a lot of tension inside, in this area.
Does that manifest in some ways gynecologically, bowel-wise, urine-wise?
I had a really, last year, before I started on the course, I had months really, literally, of blood in the stool for a long
Blood
time.
in the stool, okay. Did
Did
they diagnose this as anything?
No, they just kept saying it's piles basically, which I really felt it wasn't. But that settled down through.
You felt it wasn't because there was no itching, no burning?
No. The reason why I thought I didn't have any discomfort when I'm passing stools. And the other reason was it was a lot I noticed it was totally connected with stress, emotional stress and diet. So I mean it might have been stress, but to me that wasn't a solution to the problem.
Yeah. Okay.
So
there was something behind it.
yeah.
Okay, gotcha.
If that makes sense.
Yeah. What else? No cancer, no heart attacks, no asthma,
No, but there's history of it.
in the family.
I have had
Oh wait, history in your history.
in the family.
Okay, history of
Cancer.
cancer.
And
What else?
various fibroids and this, that and the other that had to be cut out. My mother.
But everything intact in you.
In my case it is, yeah. She had a hysterectomy, she had as well. I had meningitis as a child,
Okay.
which was very touch and go. So I nearly went. And I had E. coli, and I had lots of ear trouble. But apart from, and coughs, but no asthma or anything like that, no eczema.
So nothing else in the medical history besides the meningitis and
Emotional issues.
okay, always. You always tense as a child?
I can't remember actually the tenseness as a child, but I remember, well, a lot of it is suppressed, I must say. A lot of it I have no memory of, but there was a lot of family discord, and I remember being very frightened as a child at night time, and had anxiety.
What age did you have the meningitis?
Very early. I don't.
You don't have memories from before meningitis, in other words?
The only thing I remember as a child, as a small child, was being in the hospital.
For the meningitis?
No, that was before the meningitis. From the meningitis, I don't remember a thing. But before I had meningitis, I had E. coli, and I remembered I had to be separated off and isolated because parents weren't allowed to see the children or have contact with the children. So I remember this massive glass wall. That's all I remember from that. And from the meningitis, I don't remember anything, but my mum told me about it, and it was very bad. The way it was, because when you have meningitis and it's very and they don't know that they puncture you, don't they? They puncture the spine, and they had to do that with me. And I remember, well, I don't remember, but my mum was telling me that she had to hold me, and she had to help holding me, and they don't give you any anesthetic, and I basically fainted with pain. So I think there must have been a lot of emotional suppression there, But I'm not
was
afraid
your
of
mother
doctors.
sick? Was your mother sick when you were a child?
My mother.
Yeah. Because you said your mother had cancer and also could
Yeah,
was
she
sick
had.
when you were a child?
Yeah, she had, after the birth, she had to have something removed from the breast. And later on in life, she had to have something removed from the breast, then she had something removed from the ovaries. And then they said she can't have another child because of the ovaries removal. And then she did have another child. And after that, she had to have a hysterectomy. But, yeah.
Okay. So what was the other thing? What was the extra thing?
Well, she said, I've got like, at the back here, what are they called? Erector spinae muscles. When somebody touches this side, it's not so much on this side because it's virtually non-existent. When somebody touches this side and they go into quickly, not slowly, I'll jump, and it's a very sort of...
That's a liver presentation. That jumping, some people you touch the vertebrae on the back, and no matter what you do, it's like they go berserk.
So it's very sensitive back generally. If you just touch the back, they're like...
Yeah, that tends to be liver. The only, it's very, they're going to do it to you, and they say, I can't control it.
Yeah,
It's not like they're scared of you or anything like that.
Yes.
And I'm not quite here if possible, unless she's screaming.
No,
Alright.
So
Just starting to move some points where it almost seems like there's a reaction when you press and everything. I call them like dogs at a point. Dogs have a point that makes their leg go.
Making the leg go, I'm not sure.
No, it doesn't make the leg go, but it's just that same kind of uncontrollable reflex that makes them.
So what you can do is you can do liver 8 and then see what else, if that reduces it, but it will generally doesn't go away. And they'll do it every treatment.
Because I found that on the front as well, and it's the same, it'll be the same.
The front a little different. I think it's more, if it's on the front, unless it's one particular spot.
Yeah, it's one particular spot. I've got one woman, I didn't sort of shifts.
Okay, then there's something weird in that spot, then no, but I'm talking about a bunch of places on the back, almost like, usually people have 3 or 4 vertebrae that are really bad, and then the rest not as bad, but it's generally a fair area, it's not one spot.
Yeah.
So, okay. All right. So, the back, okay, so relax, it's all right. Is the pain around here?
No, it's pain.
Just slightly tender, okay. Slightly tender here. Or more here.
More there.
Okay.
Yeah.
Okay. How about this side also?
No, not like the other one.
Okay, so more right side of here.
Yeah.
Clear.
Yeah.
Alright.
Where's that, your problem?
I would say it's just under the iliac crest. So I was thinking maybe it's immune. You had, oh no. It looked like you might have had a cut there.
No.
But you didn't.
No.
Oh,
I
that's
had 3 children, but
all regular births? Oh, you had a thing. Did you have a?
No, I didn't have a thing. I had nothing.
Still something interesting in that navel. You didn't have a navel ring. Okay.
No.
Okay. A purple one would look great.
Get rid of the puppy bits first.
Which ones? Okay. I think some people would swap you without it. Okay. Do you know what your blood pressure is?
It's on the low side, that's all I know.
On the low side.
On the
Okay.
low side.
I can quite say categorically that her pulse is autonomic nervous system. It's thin and wiry, but I can't say that it truly changes quality. Now it does, but I can't say if I'm imposing it at this point. I'm not 100% sure. Okay, so that's why I went for it. So. Okay, so the interesting thing, yeah, not so much the hands. Navel is cold, the rest is warm. Okay, so except liver. Oh, no, yeah, a little bit hard to figure out. Okay, because it's surrounded by warmth, but there's a spot there and I can't figure out exactly where it is. That's colder. Okay, so let's see. And her feet are cold, so that basically means that she has bad circulation. What? You didn't like that? Yeah. So that can, no, autonomic nervous system type. Also, the blood vessels can be constricted. There are a few reasons for it. One is autonomic nervous system, which I'm suspecting she's likely to be. The other one is an estrogen type. Okay, that gets the blood vessels close up. Okay, so let's see what we find in the abdomen. Okay, so when I press here. Do you just feel my fingers or do you feel something different? Because you don't really know what my fingers feel like, so I'm wondering if that's...
No, it feels okay.
That feels okay. Alright, so if I press anywhere in the abdomen and it doesn't feel like this, it feels different,
Okay.
let me know. It doesn't have to be pain. It's weird, strange, whatever, just let me know. Uncomfortable. Anything here, okay, so?
It feels different.
Feels different. So something on the left stomach, 26, 27. How about this side? Yeah, this one you don't like. And your eyes kind of like, okay. So, possibly immune, possibly digestion, lung, we don't know. But right side stomach, 26, 27. How about adrenal? Yes? And adrenal this side.
I think you just put something out of the way there.
Okay.
It just went.
Okay. Now, do you see her SCM? Okay, turn over towards me. Okay, do you see how little Cardassian in the making? Okay, we're good. Okay, so we know that she has tension. Okay, now this could come from the postural thing, or it could just be congestion of the vagus nerve on its own, nothing to do with the posture. Or they can be correlated. Are you okay? We don't know which is which. No, they can both be present, but it's something to notice because I'm thinking of her as a possibility of autonomic nervous system. Okay, so this side, there is something. Okay, so adrenal both sides. Okay, whether I'm displacing something or not, it's something you feel uncomfortable and uncomfortable. Okay, how about here and 9? Okay, and no pulse either. How about 12? How about here. Now, compare the left side and right side. Do you feel there's something more on the right side or not?
No.
Interesting, because I feel when I touch, I can feel like the diaphragm pushes against me, whereas here, look at my fingers. They go in, look at my fingers here, they can't go in. I think liver is, now, by the way, and nothing here either. Okay, it's interesting. Now, I know I told you that many people will switch, but in comparison, there's really very little fat, in my opinion, okay? But in comparison, she has more here than anywhere else. If you're gonna agree with her about, oh, she needs to lose, how much do you want to lose, by the way?
No, I don't want to lose anything.
Oh, okay.
I'm just feeling flabby.
Okay, so her shape is, she would have a tendency to be more liver type, but it's clearly not very serious. You know, it's not like she's an apple shape. But if I'm looking at tendency, so I'm thinking possibly something in liver. Okay, but we'll see. How about here in 17? You don't like it. How about 15? Oh, okay, and 12 is okay? And 9 is okay. All right. SCM, 1, 2, 3. Anything? The third one? Okay. How about 1, 2, 3? The third one also. How about the scaling? 2, 3, 4. Okay, that's allowed. Don't be so surprised. 1, 2, 3, 4.
The second one was what's strange.
This one.
No, the second one. Yeah, that one.
This one. Okay.
So how are you pressing the scalene? It's actually into the top of the clavicle.
Yeah, above the clavicle. It can go a little higher as well.
Okay.
So.
When you palpated last time, the gynecomastoid, you used to pull it towards you.
No. Towards is for immune. Okay, look. Towards, this is for immune. 1, 2, 3.
Thank you.
Yeah, 3. And 1, 2, 3. So for immune, for Sanjov 16, it's behind the SMI pressing towards the nose. But for the SCM itself, it's 1, see? 1, 2, and
It's higher up
3.
as well.
Thank you. I didn't make that distinction.
Okay. Now, cervicals on the right side. Sorry. Are you okay?
Yeah.
Anything uncomfortable?
No.
1, 2, 3, 4.
Are you pressing on the quarter there or the transverse processes?
What's the distance between the Wattos and the transverse
Quite a
processes?
distance, really.
They are, okay, so you're thinking the transverse process is out
Sort of
here?
out here, kind of
Okay,
more.
I'm thinking, okay,
Yeah.
so this is muscular. So
You're going into the muscle.
I'm not going into the muscle, I'm trying to find it, I'm trying to touch the vertebrae itself.
Right, okay. But not on
So
the
if I'm all the way
muscles.
here, what I'm touching is muscle.
Uh-huh.
And that's a different story. But no, what I'm looking at is really very close to the spine. So I can touch the vertebrae and I can feel if the vertebrae has, it's like some vertebrae feel as if you took chewing gum and you put it on top of the vertebrae and then you have extra, like a little balloon over the vertebrae. That's what I'm looking for. Okay? Which is different than muscular. 1, 2, 3, no. 1, 2, 3.
Purple.
The third. Okay. All right. So we have, I'm just going to give you a review. Okay. Oketsu. We'll call that immune. Adrenal. I think there's something here that you don't. I know.
Yeah.
It's okay. It's okay. Red 17, you don't like, correct?
No, that's okay.
That's before it wasn't.
Oh no, the one down here is okay.
Okay. No. Okay. We'll let go of red 17. Okay. And this one? Yes. And SCM on this side? Yes. And scaling. All right. And low blood pressure, right? You said?
That's what the doctors say. Right?
Okay, that's good. Do you mind that staying
I'm
on?
fine.
Because I have to, I'm going to recheck. Okay. All right. So you wanted liver
Yeah.
A. Well, first of all, any pain here?
Can you call with pain, but it's not particularly comfortable.
Not particularly comfortable. How about this one?
No.
Okay, so in compared to spleen 2, liver 2, something in liver 2.
Yeah.
Okay. How about kidney 2?
No.
Kidney 2,
Fine.
spleen 2,
That was a bit
spleen 2,
funny.
okay, spleen 2 and liver 2.
Did that say
Maybe.
one?
Liver 2?
No, that's. Oh yeah, that was.
Oh, yeah.
Yeah.
Spleen 2, liver 2, liver 2 and spleen. So liver 2 both sides and spleen 2. By the way, do you have a tendency towards diarrhea?
And it's since last year I have, yeah.
Since the piles?
Since that blood thing, yeah.
Okay,
I didn't have it before.
1 second. So liver 8 is take the crease, come all the way, and now look for a nodular feeling. I know some people want to take it here as if it's you know at the thing of the bone. It's not. It has nothing to do with the bone.
Can you also do that on the other knee so
Yes.
the thumb can get it?
So. So if you touch, she's not a terribly good example from the, I'm thinking of using it on her. Come to place my finger, yeah. So,
Yeah.
okay. So touch around so that, no, don't come on top of my finger, come from below and so that when you get to my finger and you replace me, you can feel, do you feel, it's very subtle in her, there's a little hill there.
Yeah.
It's that
You mean a
hill,
little bump?
the little nodule.
Yeah.
Yeah, the nodule is liver 8.
Really?
Liver 8 is your main point. It's not here. It is not here. Where do you see the definition in the book that it's under the trochanter?
Where you just fall off to go into the muscles that would be there. So it's very close, but we go for a little soft thing.
I go for the nodule, personally. Yeah, but I've seen people try and do something above here as if it's, you know, like they're trying to do something like spleen under trochanter and they want, yeah. This is it's too far off. You know, liver 8 should be level with kidney 10, in my opinion. If somebody has essentials or something, we can look up the official definition, because I honestly don't remember what it is. Kidney 10 is basically the edge of the crease.
Between the tendons or?
Officially, yes. Semi-membranosus, semi-tendinosus is my recollection. So, and if it isn't, you know, what the hell?
So is that?
What?
I've got anterior border insertion of semi-membranosus.
Yeah, that's kidney 10. What about liver 8? What?
Liver 8.
Is what?
Above the medial end of the transverse crease, posterior to medial condyle tibia, on the anterior border of semi-membranosus.
Okay, anterior border. Okay, so listen, can you say that whole sentence in 3 different lots? So start saying it and I'll stop you.
Alright, above medial end of transverse crease.
Medial end of the transverse crease of the knee. Okay, so medial end, okay, I'm here.
Posterior to the medial condyle of the tibia.
Posterior to the medial posterior, so I can't go this way. It has to be behind the condyle. Okay, go
On
ahead.
the anterior border of the insertion of
Okay,
semi-membranosus.
so here's the semi-membranosus. I have to go on this side. So anyway, so what they did to us is this. They told us the level is level with the crease of the UB40 crease.
Yeah.
They said, do not go any further forward than the tibia. And then they said in the actual location, so they defined the up-down with level with UB40. You can't, meaning it cannot be here. Okay, that's not level with UB40, I'm very sorry. So, the crease.
Could you move that hand that you've got lower down? Thank you.
Take the crease, do not go any further forward than here, because that's the condyle. And now they're defining where the point is. It's anterior to the semi-membranosus. What I'm saying is, around here, now start looking for the nodule. Here, in my opinion. There'll be a nodule there.
Is that the index finger or the middle finger?
The middle finger.
Yeah.
Do index fingers.
Yeah.
I'm way too polite. No, I've not moved it slightly. It's like, remember, liver A is a fibroid point, which means that's its biggest use for me is fibroids, which means to me it should have something that you can associate with a fibroid in the way it feels. All right, moving on.
Kidney 10 would be more.
Kidney 10 will be here. No, further back. A little lighter with your hands. It'll be easier for you. I know it's hard because you're trying to find a way of making the point of therapy. Yes. Okay. All right. Let's see what we can gain. The reason I asked about diarrhea, spleen 2 left side, liver 2 right side is typical of people with loose bowels.
Say that again, sorry?
Liver 2 right side, spleen 2 left side is typical. Remember, I told you, that's typical of the people who tend to lose bowels or diarrhea. Remember we talked about constipation and diarrhea? I said diarrhea is spleen and liver metalwater or fire point will show up, whereas constipation you do stomach and gallbladder metalwater. Does that make sense? All right, let's see what I can get out of. Do you still remember you have here adrenal, and you have here and here, correct? Okay. How is this one now? Gone. How is this one now? So much thinking. Okay. We're going to have to end up with spleen on her because too much thinking, but that's okay. All right. Now she's not resisting anymore. Okay. So she couldn't tell, but it was me.
So that's liver 8?
That's liver 8 right now. Yeah. And I'm starting with the right side, checking on the right side because of the liver, because I'm thinking liver. Hold on a second. How is it gone? So do you see that the principle is if I were going to go by the protocol, I have to do adrenal first. I'm basically ignoring that and looking what do I care about as an ideal by medical history. It's actually not medical history. I'll tell you what I saw in a second. But I just wanted to prove myself. Hi, how about this guy?
No,
That's still there. Okay, that's fine. Okay.
I think I might need the toilet.
Okay, give me 1 second. I won't give you the toilet, but I'll give you the opportunity to go. How is now? That's okay now. Okay, so I still have to add adrenal.
Was that
It's
liver
okay.
5?
Okay,
Which one
toilet
was
time.
that?
No, don't worry. We can discuss you while you work on it. Did it help? Kidney 7, I tried.
You're pressing it, yes.
Because the only thing that liver 8 did not resolve is the right side 26, 27. Remember, can be kidney for women. Now, go
Was it
on.
the tender vertebrae you went in the first?
The what? The tender vertebrae was part of it. No, I'll tell you what cued me in. Freezing feet, freezing navel. Do you know a formula called Sini Sun?
Yeah.
So I know there's a Sini Tan and a Sini San. It's the liver one that I'm interested in. Okay. There's a formula that is basically when the liver is stuck. Okay. The circulation can't go out. Everything because she's warm, and then it's frigid out there. And navel is like external circulation. Okay, the navel, even though it's in the center of the body, is actually the last area to get, it's a venous return situation. Okay? So I'm thinking she's a Sini Sun person from that. Yes, so there were other liver issues. Now, autonomic nervous system, in some ways, we can relate to liver, even though we don't see it treatment-wise. Now, she had, you didn't have any gynecological problems, right? But Mama had lots. Okay. So if she inherited something from mama, that would have been a liver type situation. Because mama had cancer, mama had fibro, mama had all this stuff that seems to indicate liver stuff. Okay. Now, you can do totally other diagnosis on her. And go into the separation issues, and, we didn't figure out what the family dynamics are because this class is not about doing psychological treatments, but you can also assume she had meningitis, she was separated from parents, but, there was also some dynamic problem. So I just went very fast into, if mama was very sick, then there's also, separation issues.
And that would do what?
Then I would have to sort of try and figure out a story as to how do I make it in her body, make her, I'd have to figure out what it is that the body is not satiated with. But, to do that in class is probably not a thing. So I'm trying to work with the body only as much as I can. Are you okay?
Thank you.
Okay. All right. So I think liver 4, liver 8, plus adrenal, and then let's see what's left. So,
Liver 4 because?
metal water.
All right.
Oh, and she means on this side. Okay. So this side, you had here, you have here. You don't need this one. Okay. Hold on. Let me see what I can extract out of my spleen metal water. Hi. Gone.
Can you do it again?
Of course.
Yeah, there's a slight tinge there still,
Okay.
and very deep.
Okay, fair enough. So I'm basically proving to myself that the metal water points that the fire points that I find that are worth dealing with, that they're going to have more than. In other words, just because you find a fire point, don't go and do metal water. If all it's going to do is fix the fire point, who cares? She didn't come complaining about spleen tooth pain. She's complaining about tension in the whole body. So can I do that for her is the main thing. Now, but because I can either do spleen 5, and I could do spleen 5, but I'm curious if, okay, you have here, right? Correct? Hello?
Yeah.
Okay. With spleen 6, how's now? Gone. Okay. So the reason, if I'm already going to do spleen, I might as well do blood pressure. So I have a lot of flexibility of taking protocols and bending them around. It's not a big deal. It doesn't have to be the protocol. All right. Shall we get you started? Is it okay to start? Okay. All right. By the way, anything here? And she has tight head, that's good. No pressure pain, no nothing, right? Okay, good. All right.
Tight head, you mean the scalp doesn't move very much?
Yeah, some people, it's like
Very
it moves all over the place.
Yeah.
It's like, whoa.
Yeah.
Like, is that attached to anything?
Yeah.
So spleen 6, spleen 9. Okay, so I'm sliding up. When my hand wants to move to the side, I don't let it. And it's that chubby part that I'm trying to needle into. Needle okay? You sure? Hmm?
Just to see the context of the knee.
And then I'll start with right side liver 4, liver 8, because it's more right side is more important for liver. She also had liver 2 pain on the left side, but I'm going to start with the right side and see where What else needs to be done? You okay? What, it wasn't comfortable?
It was just a bit weird.
Is it okay now?
Yeah.
Are you feeling okay? Is your throat stuck or something?
No.
Okay, just making sure. All right. Now she gets stuck again. Interesting. So sorry. You okay? That's okay. Okay. How's adrenal?
Nice.
Okay. Adrenal on the right side?
Yeah.
Still some. Okay. How about this guy?
Fine.
How about this guy?
Mm.
It's okay?
Yeah.
Not sure. There's something,
Mm. It's okay, it doesn't hurt.
but there's something here.
Yeah.
Okay, something here and clearly something here.
Yeah.
Okay. Sorry. How's now?
Still there.
No change. Okay. So before I did kidney 7 and it changed it, now it doesn't. Okay. So, how is this guy?
Good.
And this guy?
Good.
And this guy? Alright. So we still have this one and something a little weird here. Correct? Yeah? Okay. How's the adrenal now?
Still something there deep down.
Now?
Yeah.
How much is left?
Okay.
Hold on. Yeah.
Still there.
Okay. But this is good? Okay. I wanted to see if UB2 was going to be the good friend of Mushu. I'm sorry.
Why have you chosen Mushu?
The first thing she said was, I stand like this. So I'm trying to give her
Yeah.
You go there rather than physics.
I wanted to show, okay, if I'm going to do the full protocol, it's kidney 6, inner ear, Mushu with either stomach 9 or UB2. That's, or here under the teeth. That's the so-called full protocol. I mean, that's, you know, I'm calling it a full protocol. I mean, it's something I invented, okay? But I can take any part of it. You know, the main part of it for me is this. Okay, but it could be inner yin, by the way, also. Okay. Just making sure. Good, Albert? Okay. And by the way, now she has a pulse around the navel. Before it didn't feel like she did.
Is the navel warming up then?
Hmm? Yes. Still, but it's still cooler than the rest. By the way, you have a television there. You can, instead of looking at your body, you can look at your... No, because therefore you don't need to feel uncomfortable. You know, if you're lifting and something feels uncomfortable, you can just look sideways. Excellent. All right. By the way, liver 8 is also important for people who have meningitis. We call basilar artery insufficient. They have tightness here in meningitis, right? They can't do this. We use kidney plus liver 8 plus triple warmer 8. Okay, we call basilar artery insufficiency. So, you know, it's not just meningitis, but that would be one of the things that they'll have. Okay. Liver, it's officially the combination is according to Nagano, it's kidney 10, liver 8, and Sanjo 8. But If you ask me, kidney 10 is not the best point. Either kidney 7 or kidney 9 will tend to do a better job. Any discomfort? No. All right. So either 4 or 6. Anything left here? Yes. Okay. How's now? And compare with this. The other one is better. This one is better. Wait, I'm sorry. I need to find. Oh, actually, no. This side I can do. Pericardium 4. I'm basically completing blood pressure treatment. We still have under the second toe. Are you alright? You sure? Yeah. So. Any discomfort? In the palm?
No, it just fits.
It's not, it's sweaty, yes, yes. Autonomic nervous system people do. Anything left here?
Yeah,
Okay. Compare with
the same.
the same. Okay.
Yes.
Okay.
You were comparing pericardium 4 and pericardium
And 6, which one does a better job for the neck, but it was kind of the same, so it was relatively relevant. We'll finish blood pressure treatment with under the third toe. You okay? Wasn't fabulous?
No.
Oh, sorry.
My one's okay.
Do you see the oily tissue? That's another liver indication.
So these little ones just happen and then
You just tap them, you don't do anything else. It's not very pleasant to do much more.
in general, needling, you're not
I'm not doing huge amounts.
you're not doing huge amounts, but also you're not I don't know, needling in when the person it breathes in or out or all that.
Yeah, none of that business. It's too difficult. You know, all these Taoist ideas, blah, 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 blah. It's like, just get the needle in, you know, just do what you can. But, you know, if you like that and you think, if you see that it's really clear, it really helps, go for it. But no, I'm not, especially, you know, it's like, just do your thing as much as possible. Okay. How's the back now? Okay. Is there a movement that makes the back unhappy? No. No. Okay.
So the only needle that you can do on both sides is the floor. Alright.
Yeah, actually you're right. I mean, officially I should, but yeah, it wasn't meant to, I wasn't trying to create an aesthetic situation. It just happened that way. And I mean, officially, because she had, by the way, how's liver 2 now?
Okay.
It's okay? Liver 2? How's spleen 2?
Fine.
Good. Okay. So it's these now. Now I do want to do immune because she had the meningitis. 1, 2, 3. Anything? Here? No? This one?
Yeah.
Okay.
Anyway.
Tender. Oh, sure, that's good. Hi, how's now? Good? So immune point.
Just on that side. Just on that side.
No. It will be close. Yeah, I'm not replacing liver 4 with immune. One, 2, 3. Can you look straight up? 1, 2, 1. how much is left?
Very little.
Okay, let me see if I can get a better situation. How's now? Then how much is left?
Do it again, please.
Sure,
Yeah, that's okay.
Gone? Oh. So if somebody says better, but if I can get a little bit more, I'll change where the point is. Now notice the immune point is needled towards the small intestinal channel also. So triple warmer channel, I tend to needle that way. Because I consider that to be on the triple warmer channel rather than on the intestinal channel. Okay, are you comfortable? Shall we cover you?
Yeah?
Yeah, don't worry about the needles, they'll be fine.
Will you do Sanjiao 8 and 5 in that same direction, or do you do that?
Sanjiao 8, yes, Sanjiao 5 doesn't have it. Sanjiao 5, it's hard to get in that direction, so Sanjiao 5 tends to be a little bit more straight in. But I would aim it this way, meaning on this side, towards small intestine channel, yeah. Any questions? And let's just do it. Are you okay? You sure?
Yeah, I feel really good.
Okay. Then we'll do marks at the end on the immune points. Okay.
Yes.
Yeah.
What is obviously very good treatment is a good clear up of all reflex zone. How long
Do they stay away? Depending on the person. It has nothing to do with your treatment well, it has something to do with your treatment. But the reflexes will come back the next week. Some people, the reflexes don't come back and tend to be weaker and weaker. Some people, the reflexes stay forever, but the symptoms go away. You just can't guarantee it. So one of the methods of diagnosing people is not just, first of all, how easy was it to clear the reflexes, but secondly, did it stay away? And thirdly, how are they feeling the following week? So it's not, first time is not your diagnosis time, it's just the beginning of the diagnosis. The assessment really happens the second week. So you really should charge them first appointment fee, second appointment fee higher. Third appointment is regular appointment, third, fourth fee. Do you know what I'm saying?
Yeah.
So that because second appointment is just as important as the first one.
But if the reflexes have gone on the second appointment, we can presume...
Then you just repeat. You don't have a choice, especially now. When the reflexes have gone the second appointment, but the symptoms stay the same. Don't just repeat. Now you've got a real problem because you have no way of assessing what you want to do. So you did such a great job on the first treatment in treating the reflexes, except it didn't help the patient. So now you basically shot yourself in the foot.
Have you seen that happen?
Yeah, it can happen. Partially it's that the reflexes tend to, for most people, not everyone, but for the large majority of people, tend to get weaker and weaker. Because the first time is always like a big shock. Oh!
Yeah.
Like they've never felt your fingers before.
Yeah.
So it's much stronger for them. Whereas, they're much more used to your fingers. So they'll still say something, but it's not going to be as dramatic. Also, as you probably know from any style, whatever you didn't get in your first treatment, that you get much more dramatic results in the first treatment than second, third, fourth. That the big jump tends to be in the first or second treatments. Afterwards, there's a certain maintenance value, but it's rare that you get a patient that didn't move and suddenly they make a leap. And if that happens, it's the patients who insist on coming, and that will happen suddenly on the 10th treatment. It's rare that it can happen on the second or third, because sometimes you didn't get the right strategy and you're changing on the second treatment, you're changing what you're doing. But someone that you're continuing to treat on a regular basis, like you're getting the diminishing, because there's a big, especially people who've never had acupuncture before, there's like a big shock value to the system that you're benefiting from. And after 2 or 3 treatments, it's kind of like, oh, okay, all right, acupuncture treatment, okay. Well, I'll respond if I have to, but, And then eventually, then it's a maintenance factor. So often, a lot of people, I tell them, do not try more, they say, how many treatments? I say, try 3 to 4 and decide if it's working for you. I don't do the decide, come for 10 treatments. That does not work well in my